is my 24-week pregnancy vlog. Yesterday morning, I was feeling some cramping and was really tired yesterday and felt like I needed a nap. So I woke up yesterday afternoon and I was cramping pretty bad in my back, my lower back. And I got up from my back into my pelvic. So now I'm not only having cramping in my lower back, but also my pelvic region. And so I walked into the bathroom, didn't think anything of it. I just thought it was Braxton Hicks, and went to the bathroom, a significant amount of blood. First thing I did was I called my mom, and I asked my mom, do you think I should be calling my doctor? And she's pretty much telling me that's what he's there for. So I call my doctor, and I have the on-call doctor paged, and she calls me back, and she's running through my history, and I've never spoke to her before. And she says to me, so this is your third time bleeding? I said, yes. She asked me how far along I was, and I said about 24 weeks. And she said, is this the first time you've had this kind of cramping with the bleeding? And I said, yes. And so she said, I want you to come into labor and delivery, and I want them to observe you. And I'm like, well, I live 5 minutes from another hospital. And she's like, nope, you need to come into labor and delivery where your doctor practices, because if there's anything wrong with you or the baby, this is where we are, this is where we practice, and if there's anything wrong with you, they'll admit you over there. They don't have a NICU over there. They aren't equipped with dealing with a high-risk pregnancy as you are. You're not equipped to deal with a 24-week-old baby if the baby comes. And she's just running through all these things, and she said, so you can either take the convenient way and go to that hospital and just be looked at to make sure everything's okay, or you can come to labor and delivery at St. Luke's and make sure everything is fine. And if everything is not okay, we're equipped to handle whatever the issues are. So I said, okay. And to be honest, I was planning to drive myself in there. I didn't want to bother my mom. I didn't want to wake up my husband because he had worked graves all night, and I just had it stuck in my head that I don't want to bother anyone, I'll just go myself, which is an hour and 20 minutes from our house one way. So about an hour and 20 minutes, especially on weekend traffic. So I end up calling my mom back and telling my mom, and she's like, I'm going to take you. Okay. So I call my husband. I wake up my husband. He's like, what? What's going on? And I told him, and he's like, I'm getting up. I said, Ellen, you really need to sleep. You have to work tonight. And he's like, I know I do. He's just like, I said, my mom will take me. It's fine. If anything happens, we'll call you. And if you absolutely have to, you can take vacation time. He's like, no, I'm going to go with you. He's like, I'll never be able to go back to sleep now. And I'm like, Ellen, look, everything's fine. My mom will take me in there. If anything happens, she's going to call and let you know. And so my mom goes ahead and she picks me up. So we get up to the hospital, go on the second floor into labor and delivery, and they want to put me on a contraction monitor that goes around my belly to see if I'm contracting. And I was having contractions. My blood pressure was elevated, and I don't feel like they were contractions, but I've never been pregnant before. I just associated them to very bad menstrual cramping. That's what it felt like. The bleeding had slowed down some, and I was just pretty much spotting at that point. And so they have me go pee, put on a gown and all that. And then she comes back in about 15 minutes later and says there's protein in my urine. And I looked at my mom and I said, there is no way. 40 minutes later, and I'm busting to go pee, and there's this fetal monitor and contraction monitor and all these things hooked up to me. And I finally tell my mom, I really want some water and I really need to go pee. So the lady comes back in and wants me to go to the bathroom. And I go in the bathroom. My urine is still sitting in the number 10 spot. the cap on the urine exactly how I put it on there because it was kind of lopsided, and my initials on it in the number 10 spot. I couldn't open the door, and it was a public bathroom. It wasn't like a private room bathroom. I opened the door and I said, Mom, come here. And so my mom goes in there and I said, that is my urine. Look at my initials. I put it in the 10 spot. The cap is exactly how I put it on there. And so I questioned her when she came back in the room, and she said, I tested the urine in the number 3 spot. You're room 3. And I said, I put my pee in the number 10 spot. The cap was kind of crooked. I have my initials on it. And she's like, oh, she's like, they need to start remembering to tell people to put your urine in the slot of the room. Well, when we come in there and we're not feeling well, like, we know what room we're in unless they tell us. So, bless the lady's heart in room 10, because she had protein in her urine. She just got told she didn't. And here I am having my urine tested finally. No protein in my urine. They came in and they had done an ultrasound. Skarlett is fine. She had 144 beats per minute. She was moving, and she has flipped. She's not head up anymore. She's head down. Her feet were now on the right side. And that's why I was thinking, because I hadn't felt her in 2 days, since the night before Christmas. The last time I felt her was early Christmas Eve. But she had flipped and her feet was on the right side and her head was down, and she was kind of at a diagonal. Everything looked good. She looked fine. She was being active and moving. So then about an hour goes by. My mom was like, I wonder what's going on. I was like, I don't know. So then the girl comes in and says they'll be on their way. And I'm like, be on their way for what? And she's like, oh, I thought they came in and told you. She's like, the on-call doctor for your doctor said that she wants to have your cervix and your placenta checked. And you have to go downstairs for that. Transport comes, transports me downstairs. And another lady comes in and does an ultrasound. And she says, you know, we're going to do a vaginal ultrasound. And I said, vaginal? And she's just like, it's just much more accurate to tell how your cervix is and how your placenta is. And so the radiologist can read it. And Skarlett, from just an hour, has moved again. She's went from being like this, head down here, feet up here on the right side, to this, head down here and feet on the left side. And her heartbeat was 166 beats per minute. Different machines, different, but she definitely moved again. And by that time, every time she is on the left side with those feet, I feel her. And when they transferred me down there, every time we hit a bump, a couple seconds later, I would feel her move. To see the heart beating, but then she turns on the sound. I'm a person more than I'm a visual in regards to her, because as soon as I heard her heartbeat, I lost it. I was like, thank God, she's okay. And this is the first time we have saw a side view profile of her. And I said, I know I'm not here for pictures. I know I'm here to make sure everything's okay. I said, but this is the first time I've seen a side profile of her. You put out a picture for me. I said, I know this is probably inappropriate to ask. I said, but I've never seen a side profile of her. And she said, yeah. And she printed us out a picture. And she definitely looks like a baby. She's definitely developed. We saw hip bones. We saw pelvic bones. We saw rib cage. We saw the spine. I mean, this was like creme de la creme ultrasound machines, and she's developed. We saw cheekbones, ear bones. She's got a massive forehead like her mom. She's got a big head like Ellen and I do, and she's doing good. My orders stand as I am supposed to have 100% pelvic rest, meaning no sex, no intercourse, until I see my doctor on the 5th. And feet up when I'm laying down, no stomach or back sleeping, try to only sleep on my sides, buttloads of water, and just to take it easy. Tylenol for any kind of cramping, and if it gets any worse, then to call her back or call whoever the on-call doctor is. So definitely if you're having these kind of issues, go where your doctor's at. Go to where they have a NICU in case something happens. Now that Skarlett's 24 weeks, she is considered viable outside the womb. And we have a fantastic NICU, but you got to be committed to going there. So it was a good choice to go there, just to put my mind at ease, and my mom and my husband, and I want to thank all them from the bottom of my heart. So that's my 24 weeks, and I hope everyone is doing well, and you all take care, and be easy on yourselves. God bless.